We'll talk about the rotators of the hip joint. The medial rotators of the hip are the anterior fibers of gluteus medius and minimus, tensor fasciae lata, iliopsoas adductor longus pectineus. Iliopsoas adductor longus pectineus, if you look at it, it starts from the medial aspect and is inserted on the posterior aspect of the shaft of the femur. When it pulls the posterior aspect medially, it would appear to laterally rotate. But because these muscles are crossing the hip joint from anteriorly, irrespective of where they are attached to femur, access passes through head of the femur. So any muscle which crosses from front of head of femur will necessarily cause the entire femur to move in like a gate of a garden, where the vertical axis, you can hold the gate in front from the handle, or you can hold the gate from entering the slot in the gate and pull it from posterior. Either way, it will cause one directional movement, and that is the medial rotation. The lateral rotators of the hip joint is gluteus maximus, sartorius, although it's crossing in front, but it's crossing from lateral to medial, and posterior fibers of gluteus medius minimus, and 6 short lateral rotators from above down: piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris, and the muscle that lies deeper to quadratus femoris is the obturator externus. So 6 short lateral rotators. Now this is as far as the normal medial and lateral rotation of the knee is concerned. What happens if there is a fracture of the neck of the femur? Elderly osteoporotic female sleeping in the bathroom and fracturing her neck of femur. The moment there is fracture of neck of femur, the axis of rotation now passes through the shaft of femur, no longer through the head. Any muscle inserted on the back of the shaft will now pull the back of the shaft medially. The front of the shaft will move laterally, that is lateral rotators. So all that were originally lateral rotators continue to remain lateral rotators, and iliopsoas adductor longus and pectineus, which were originally medial rotators, now become lateral rotators. So what is left out of the medial rotators are only anterior fibers of gluteus medius minimus and tensor fasciae lata. Therefore, there is an overwhelming shift of the lateral rotation, and the foot of a supine person, which otherwise the toe should point to the ceiling, now turns laterally and the two toes point laterally. So if we see an elderly osteoporotic postmenopausal female lying in the orthopedic ward with one toe pointing upwards and one toe pointing laterally, you know what has happened. If you go and ask her what happened, she will realize you are a novice, you are good for nothing. She will not develop a rapport with you. Instead, you should go and ask her, when did you slip in the bathroom and broke your right thigh? Arre, he knows the answer before reading the case papers. He must be a good doctor, let me explain to him. Now, listen to the exact story what happened. She was sleeping in the bathroom laterally. A reflex contraction of strong adductors to prevent you from falling laterally. Now, a lateral slip, medial pull by adductors, causes the neck to snap, and the neck has fractured. Because the neck has fractured, she fell. History given by her: I slipped in the bathroom, fell and broke my thigh. Correct history should have been: I slipped in the bathroom, I attempted to fall the slip, I broke my bone and I fell. So it's not the fell which broke the femur, it is the break of femur which causes the fall. Moral of the story: When you are sleeping in the bathroom, slip and fall. Femur is adequately closed on all sides by muscle that will not break. But head injury and other things can happen. So that is, thank you.